Selamat pagi Bapak Ibu sekalian. Kali ini kita akan berjumpa kembali dalam topik tentang bagaimana sebuah organisasi pelayanan kesehatan seharusnya membuat perencanaan secara lebih tepat, dan ini berhubungan erat dengan perubahan secara organisasi. Baik, izinkan untuk share screen. Pagi ini yang kita akan bicarakan adalah tentang plan change in healthcare organization. Materi ini saya buat bersama dengan dosen saya, Dr. Muhammad Nasir, sehubungan dengan penelitian kami tentang bagaimana organisasi pelayanan kesehatan ini di era pandemi COVID, bagaimana kepemimpinan dari organisasi pelayanan kesehatan di era pandemi COVID juga. Abstrak dari penelitian ini, kita temukan bahwasanya adanya disrupsi antara essential human right, yaitu hak asasi esensial dari manusia, terutama dalam hal ini di pelayanan maternal, termasuk di dalamnya adalah hak asasi untuk hidup dan menjaga kehidupannya. The right to the health and access to the healthcare, adanya hak untuk mendapatkan kesehatan dan akses ke pelayanan kesehatan. Kemudian the right to freedom of movement, jadi hak untuk dan kebebasan untuk bergerak. Keseluruhan dari fulfilling the right to health and access to public services during a pandemic merupakan satu tantangan sendiri pada setiap negara. Bagaimana policy kebijakan-kebijakan dari pemerintah berhubungan erat dengan akselerasi dari angka-angka kematian dan kesakitan yang secara cepat berubah, sehingga healthcare organization generally have a complex and rigid bureaucracy. Dan sebagaimana kita ketahui bahwasanya organisasi-organisasi dan pelayanan-pelayanan publik itu biasanya mempunyai birokrasi yang rumit dan kaku, terkesan kaku. It's very difficult to implement organizational change, dan hal tersebut mengakibatkan tampaknya kita menjadi tergagap-gagap dalam mengatasi era pandemi ini. The aim of this research, ya, jadi penelitian yang secara literatur ini bermaksud untuk to identify the concept, factors, and implication of organizational change to help healthcare organization mendefinisikan define strategies and policies for plan change. So this research theory and was library research with data taken from books and journal articles related to organizational change theory and change management, and we adopt the some things happens around us about the condition in the pandemic in Indonesia. The data were collected through documentation using a research material classification checklist, writing schema and map, and a research note format. Data were analyzed using contents analysis method, and the results of the study were that changes in healthcare organization are inevitable and unnecessary for organizations to be more effective, productive, and satisfying for their members and for the people and in the country. Changes in healthcare organization are related to performance obstacles, decision making, and quality of service. So the phenomenon of resistance to change is usually normal. However, persistent and excessive resistance should be anticipated through effective and intense communication, engaging staff, and generating ideas or change, and responsive to suggestions from staff and other units in the hospital or another organization, healthcare organization. We know that three essential human rights disrupted during COVID-19 is the right to live and the obligation to protect life. Yeah, the right to health and access to healthcare, the right to freedom of movement. We know that there's something regulation, more regulation, and change regulation, and lockdown. That's maybe the right to freedom of movement is we know that's something difficult for us. Fulfilling the right to health and access to public services during a pandemic is a challenge for every country in the world. And the complex in the relationship of social health determinants such as poverty and living condition, we know is from years to years increase the risk of unfair and equal access to health services. So the government policy is also an important factor in fulfilling public health rights. The increase in daily fluctuations in COVID-19 cases in Indonesia is unclear. Indonesian government in general only reports the number of data on the addition of infected people, the number of recovered patients, and the number of patients who died. And we only knew a little uh, the data of maternal morbidity, maternal mortality, and the neonatus. Indonesia had difficulties to develop a surveillance strategy to break the chains of transmission and also handle the COVID-19 outbreak. This has an impact on health services that are required to keep up with the changes and are dynamic during the COVID-19 pandemic. Uh, we know that with the doctor and nurses and other public health resources uh, need need something information, more information about the COVID-19, the dynamic of COVID-19 and our country. Organizations, including health services, generally have complex and rigid bureaucracy. We know that, making it very difficult to implement organizational changes. However, the COVID-19 pandemic and the need to combat the spread of the virus are driving a radical change in people's mindset about how processes and interaction can occur in organization. By their very nature, healthcare demands a higher degree of autonomy and independent thinking. We know it's the ethical, so that individuals in organization generally have difficult accepting change without clear and convincing scientific evidence. The need of organization plan in healthcare is finding a theory that is most appropriate to be applied in healthcare organization is a challenge. Therefore, manager or change agents in healthcare organization must be able to identify suitable theories or models of changes to provide a framework for implementing, managing, and evaluating change. A comprehensive study of organizational changes in healthcare and its factors and implications will help healthcare organizations define strategies and policies for planned care. So we really need that that things to make a change with the planned care, not make policy, and then we change again, change again. We need needs time to longer the planned care. Factor contributing to changes in healthcare organization right now and from years to years is increased cost of care, labor shortage, professional obligation, clinical governance and code of ethics, scientific and advancement, population aging, population aging, and the circle of life cycle, patient satisfaction, and promotion of patient and staff safety. So that the complexity above often causes change attempts to fail because change agents take an unstructured approach to their implementation. Okay. From our research, we have a result and discussion that organizations need to change in order to be effective, productive, and satisfying for their members and people in our country. Van and Pool assumes that change is purposeful and adaptive, which is achieved by building an emergence final state, taking action to achieve it, and monitoring its progress. Organizational changes must be followed by all members of the organization. We are integrating, collaborating, uh, and we are together both as a team and individually. So that's the importance of um, meta leadership to be done in this time. Therefore, a plan change is a need which aims to first seek to improve the ability of the organization to adapt to change on its environments, and second, to change employee behavior. That's very important. Dawson said that change management occurs in three areas: politics, context, and substance. Politics is defined as the negotiation of internal organization and external environment's pressure. Context as the organization historical memory of previous changes and the current relationship with the changes that are needed at this time. That's and the substance determines the scope, priorities, operation, and timeline of the change program. That's included in meta leadership. In this case, management sensitivity is needed regarding the nature, disposition, and context of change, including the views and responses of staff, influencers, and power holders, and other stakeholders. So that's the comparison on the theory of change. There are Mr. Levin, Rogers, Lippitt, and Cotter. All of them say that there's a three-step that is unfreezing, moving, and refreezing. In unfreezing, we need awareness, we need diagnosis of the problem, assess of capacity, and motivation for change, assess the resources and motivation of change agents, and then emphasize the urgency of change, coalition forms of change, establish a vision, direction, and change strategy, and many kind of communication. And then we need a moving. In the moving, we need interest, evaluation, and trial. Yeah, trial. So we must do the PDSA and determine the purpose of the change, define the role of the change agent, and maintain change. Yeah? Change is must be a culture, like a learning culture in the organization. Empowerment of the entire organization, sets short-term goals, and consolidation and review changes. So in the step of rephrasings, we can adopt termination of health behavior and reinforce change and a new behavior. That's not a simple like what we can read, but we must do that kind of three steps. Element of change must be environment and organization. From the environments, we know that something happen in the environments, structure of social structures and other condition like a pandemic. We know that there is make the organization must be changed internal and need internal creativity and inventions to make the quality and safety in the people and the organizational like a hospital or other organizational healthcare must be happen with the internal creativity and invention, perceive problems or opportunities. Jadi we must make a SWOT analyze that ideas and needs must be adoption and then implementation and trial when the and uh, we must look the resources and what we have to make a trial and then implementation or implementation, re-implementation, trial, re-implementation, trial, evaluating, and then we always changes and changes. Change resistance must be happen when failed to implement when there is a resistance. The phenomenon of resistance to change does not have to be in the form of resistance to change itself, but rather a rejection of losing something valuable to that person. Even though, in fact, this kind of anxiety is quite normal. Sometimes we name that condition as a silo. There are Connor, Cantor, Weddell, and Sohal, and Mabin et al. Uh, make the definition of a change of resistance and the kind that can happen. Lack of confidence that there is a serious need for change, and something fear of the unknown, losing control, losing face, losing competency, or something need of security, bad timing, habit, a lack of support, less confident, lingering hatred. Sometimes different explanation of the need for change is make the change resistant. There is no agreement on the purpose of the change, lack of confidence that the goal can be achieved. We know that when the pandemic is end, when the vaccine is safe, don't believe in the way of change. So something we need rational factors. So we need more data and evidence base, so we can keep the rational factor. Sometimes non-rational factors is bigger and bigger, and it make the population uh, make the change resistant. Political factor is an important thing, and management factors is we know that the concepts of management is uh, moving and moving, and learning organization with the good management. We need good political and good clinical governance and good corporate governance. So, and the individual factors is something important, and something we with to be make capability, and then the together we are together to make individual factor is better and better, group factors and organization factors and country factors. Sustaining change, sometimes communication and training, brainstorming ideas, creating a change team can also drive change in a suitable manner. So meanwhile, the process of changes, the approach must be carried out attentively and consistent, planning, implementation, and managing resistance. So we can do aligning action against the organization vision, create gradual changes, fostering distribution of leadership, and then encouraging staff involvement, and creating interpersonal collaborative relationship. Impact of plan change in healthcare, that can be interpreted as transformation have been found to have an impact on quality indicators such as changeability, reliability, responsiveness, assurance, and empathy. And then changes in healthcare organization are positively related to performance constraints both directly and indirectly through participation in decision making, meaning that more change is associated with a higher prevalence or performance barrier. So organizational change is also negatively related to job satisfaction, both directly and indirectly. Changes in healthcare organization are an inevitable part of a pandemic area. Effective change management in health organization requires managers that have both an external and internal organization perspective. Health organization as an open system must interact with their external environment. It's necessary to acquire critical resources and overcome dynamic external influence affecting the organization. So, in addition, healthcare organization must also maintain optimal changes achieved in the internal environment. Healthcare organization change can be sustained by aligning action against the organization vision, making gradual changes, fostering the distribution of leadership, encouraging staff involvement, creating interpersonal collaborative relationship and must be done attentively and consistently, planning implementation and being able to manage resistance. So, ladies and gentlemen, Bapak Ibu sekalian, demikianlah yang bisa saya sampaikan. Pada prinsipnya, perubahan secara organisasi yang terencana membuat kita tidak tergagap-gagap menghadapi era pandemi ini. Dan bagaimana kiatnya untuk membuat organisasi tersebut terencana telah saya sampaikan dalam session yang baru Bapak Ibu simak bersama-sama. Baiklah, akhir kata saya ucapkan selamat bekerja. Semoga Tuhan Yang Maha Esa memberikan kita kekuatan dan kemampuan untuk bersama-sama dalam menghadapi era pandemi ini. Billahi taufik wal hidayah. Wassalamualaikum